So Sarah is the head of NetZero delivery at the Greener NHS programme. And she's going to come up now and talk to you about the incredible work. We're going to have 2 speakers, then we're going to have a Q&A. I want to hear lots of questions from this now packed room, which is wonderful. So Sarah, thank you so much.
Hi, everyone. Hi, sorry. So really happy to be here today. Thank you for the lovely intro. Actually, you made my life easy because you've done the depressing bit, so I don't have to go through it too much again. So Jenny already spoke to us about the impact of climate change on health and why it matters and why, as healthcare professionals, we need to do something about it. You also touched on the fact that it impacts our ability to deliver healthcare. So it impacts the health of our patients, but it also impacts the ability of our hospitals to function. If you think about last summer, some of our operating theaters were overheating. So we had to close them just because, with our quite aging estate, sometimes it was very difficult to just cool down our operating theaters. And as an anesthetist or a surgeon, you don't want to operate a patient in a theater where the temperature is not controlled. So that's the why we're doing this, and so I won't expand much on it. There is good news, though. As healthcare professionals, some of the things we can do to tackle climate change can also improve the health of our patients. Very simple example, active travel. Rather than taking your car, if you take a bike or if you walk to the hospital, actually better for the environment, also better for your health. If we encourage all of our staff to do that, it's better for our staff health. If you think about less pollution, also better, for all the respiratory disease that we know about. Better diet, a more sustainable diet, a healthier diet is a more sustainable diet. So all of this actually can also improve, all those things we've been talking about in healthcare, preventing, avoiding patients from getting ill in the first place. All of this actually can come as a co-benefit of everything we're doing to tackle climate change. So this is why the NHS has committed to reaching net zero. I have to say, we say net zero just because we're trying to be transparent. As of today, we don't have the solutions to go all the way to zero, but completely agree with what we heard this morning. It can't rely on offsets. It can't rely on, trying to get carbon out of the atmosphere. This is not ready yet. So if you look at the trajectory we've set for the NHS, we're roughly about 90% emission reduction that we're really confident we can achieve. And then the remaining 10%, we've grouped it together in a bucket of maybe offset or maybe research and innovation, right? So we've created one big bucket, just being honest, saying, this remaining 10%, we're not really sure how we're going to achieve it, but we will need to think about it. For the more knowledgeable on greenhouse gas in this room, so you know that we speak about scope 1, scope 2, scope 3. You'll hear me speak about CO2 equivalent. You'll hear people speak about carbon. Actually, it's a measure. We talk about a bit more gases than just carbon, but we all bring them down to a carbon equivalent to be able to measure our impact. And then what we've done in the NHS is we've been a bit more ambitious in what we consider are the emissions directly in our control. So usually emissions are classified as scope 1, scope 2, scope 3, being scope 1, the emissions that really happen on your estate, right? Really happens where you are. Then scope 2 is basically your electricity. And then scope 3 are all the emissions that happen around you that are necessary for you to function, but don't necessarily happen where you are. And in the NHS, what we said is that actually we can take ownership of a bit more than just those emissions that happen in our hospitals. Actually, we can take ownership of emissions, for example, like business travel. these are emissions that happen in between our hospitals, between a hospital and a GP practice, but actually it's really our responsibility. And so on all of this scope of direct emissions, we've committed to reaching net zero by 2040, which is 10 years earlier than the UK government. And this is based on a modeling that tells us that, yes, this is ambitious, but it is also realistic. And then we also take ownership for every emission that happens to make us function as a healthcare system, so including the supply chain, we've talked about it. And so on that, we've committed to reaching net zero by 2045, so 5 years earlier than the UK government. Again, it's based on ambitious but realistic trajectory. And as we've heard earlier, actually, it's not just like, 2045, 2040, that feels very far away. Actually, what matters is what happens now, what happens in the next 5, 10 years, and even maybe less than that. And so that's why it's really important to have like a curve with like a really like neat change happening in the next few years. And so we have this interim target of 80% reduction, so for the next sort of 5 to 10 years. So what does the NHS carbon footprint look like? We've heard already that more than 60% within our supply chain, so that's true. That's the blue bit you have here. So that's everything we buy, right? The goods, the services, so it is the medicines, the medical devices, but also, the IT equipment, the food, really, really everything we buy. And then you have, what you could expect, so how we power and heat our building, that's about 10%. You have the travel, so there's lots of things included in travel, and you'll hear more about it later. But you have business travel, you have staff and patient travel, visitor travel, so we have to consider all of this. And then you have some like specific medicines, which I'll come back to. So this is how we structured nationally, and very often I'm being asked, why did you pick those topics? Actually, what we've tried to do, if you look like, especially at the top, we've tried to mirror the usual functions of an NHS hospital. Because actually, greener NHS is not about just, a team of tree huggers somewhere in an office in London. It's about every function of the NHS changing the way it works. And so the way we've structured ourselves is really to try and take all those usual functions in a hospital and thinking about, okay, what do they need to change to really embed these net zero targets? And then we have some sort of like enabling actions. I mentioned research and innovation. Workforce is a very important one, right? Like we need to raise awareness, train our staff, engage our staff. Adaptation, that goes a bit with estates because we know that climate change is already happening. So how do we make our hospitals and GP practices ready? And then lots of data and modeling, and I'll show some examples of that. So I won't cover everything, but you'll hear more about some of these today in other talks. So I've tried to focus on the one that was less covered. Estates and facilities, what we're doing is really what you could expect, like trying to make our building energy efficient. Sometimes it does require a lot of money. And so we're really helping our hospitals to get, some public funding to try and make them more energy efficient. Really like this picture here. So that's it's called the Field of Dreams. It's a farm of like solar panels which power a whole hospital with the energy it generates. The good news with like our hospitals that have installed solar panels is that, when they were installed, they were like, oh, maybe 5 to 10 years return on investment. Actually, with the energy crisis, the return on investment have been way, way, way sooner. So that's been actually very wise choice. We've published a few standards to help, when we build a new building or when we refurbish a building, what does a net zero building look like to give guidance. So this is all publicly available and you can have a look. I won't cover travel and transport because I know that Paul is speaking later on, so he'll give you a much deeper view. I'll cover medicine. So I mentioned earlier that some medicines have a direct impact. So what we mean by that is that there's two groups of medicines that release emissions when we use them. And so these two groups are inhalers, like the inhalers that we use for asthma or COPD, and some anesthetic gases or medical gases like nitrous oxide or other anesthetic gases. So we have really focused efforts on those two groups because just by those two groups, they represent 5% of all of the NHS emissions. This is massive, right? This is a really, really big proportion. I won't get into too much details, but you can see here in this bar chart the difference between different inhalers. And we know that those inhalers at the very bottom, the dry powder inhalers, are actually clinically safe and appropriate for most patients. So it is about just offering this option to the patients, just raising awareness. Like we know from an Asthma and Lung UK study that more than 85% of patients would like to be offered a greener option. It's also an opportunity to improve respiratory care because we know that at the moment in this country, compared to similar countries, our patients with respiratory disease are not doing so great. There's a lot of avoidable death still happening from asthma. And so actually casting a light on the good use of inhalers, the right choice of inhalers, is also an opportunity to improve care. And at the end of the day, we're healthcare professionals, that's what we care about. This is a very, very great example, and I feel really comfortable saying it because I didn't join the team until here, so I haven't made that. It's Johnny and his colleagues who did that. So that's the story of a clinical community, the anesthetists, who looked at their practice and were like, okay, we're in healthcare. We know we have an impact on climate change. What can we do? And then they realized that out of the 3 anesthetic agents, like the gas they were using, one had a massively higher global warming potential than the other 2. And actually, for most patients, sevoflurane is as effective and as appropriate as desflurane. And so there was this quite amazing mobilization of this community saying, well, why don't we change our practice? It's safe for our patients, we have to adapt a bit, but it's fine, we can learn, we can adapt. And this is how, in the space of, just 4 or 5 years, we've seen this massive decrease. So in gray, that's the emissions from anesthetic gases. And in dark blue here, that's the use of the line. So you see the yellow line is from this alternative gas, sevoflurane, and the dark blue line is going down, to the point that the NHS has now committed to completely stop using this drug by early next year. So it is the first time that a healthcare system stops using a drug on environmental reason while maintaining high quality of care for patients. So this is pretty big. So I mentioned these 2 groups of medicines cover 5% of our emissions, but then there's also all the other medicines we buy, which create emissions, trigger emissions in their supply chain. So there's a lot we can do, and I won't get into much detail, but we're working a lot with our suppliers. I'll come back to that. We're also looking at tackling overprescribing. We know that some patients just have too many medicines for their own good. There's something called polypharmacy, which means that actually, some medicines can interact with each other. That creates, bad outcome for patient and a lot of waste. We're also working with the Royal Pharmaceutical Society to think about what a greener pharmacy would look like. So I was speaking about suppliers, and we saw that 60% of our emissions are in our supply chain. Now, when you speak about a supply chain, you have supply and demand, right? Pretty basic. So when we looked at emissions, we're okay, we probably have to work on both. We have to work on our suppliers, and we have to work on the way we demand and we consume for goods and services. So when we engage with our suppliers, we had a really positive response, actually. What we heard was, yeah, definitely, we know this is an issue. We want to help the NHS tackle its carbon footprint, But what we need from you, NHS, is to give us visibility. Like, tell us what you will expect from us, by when, so that we can get ready. And this is why we created this supplier roadmap, where increasingly we're asking more and more of our suppliers. And the objective is very simple, is that in a few years' time, so 2027, the NHS won't do business with a supplier who doesn't have a net zero target. And so we've laid out the step, and so it started, like, for example, actually from this year, April, we've been requiring a carbon reduction plan for all contracts over 5 million. So if a supplier wants to bid for a contract over 5 million, they have to have a net zero target, they have to publicly disclose their emissions, and they have to have a plan. For now, we're just looking at scope 1 and 2 and a subset of scope 3, but from 27, it will be on all scopes of emissions. And we're going like this, gradually more difficult. But we can also look at the way we consume for goods and services. So I call this the 5 R's. There's probably as many versions of this that you can think of. There's the 3 R's, there's the waste hierarchy. Sometimes you see the 5 R's, but with different R's. Basically, the idea is always the same. The idea is that as much as possible, the first question to ask is, do you really need that item? And I love this example that was led in Great Ormond Street Hospital. So it's a children's hospital, probably the most difficult place if you want to like tackle, you know, over-consuming of resources. And actually what they realized is that the staff was using sterile gloves when actually it was not recommended. So they've just, you know, applied the recommendations. They haven't changed the rules. They haven't changed the recommendations. They've just applied them and managed to reduce the use of plastic by more than 20 tons. It's just massive. And then you can prioritize reusable over single use or maybe reprocessed. And if really you have to buy new, then look at what the item you're buying is made of. Is it renewable? Is it recyclable? I mentioned research and innovation is really important, so we're doing a lot in that. And so what we're trying to do is to invest in different types of research and different types of innovations. In terms of innovation, we try and support like small businesses that have like a good idea, that have already maybe some form of a prototype, but need that extra funding to get to the next step, to think about scaling up. But we've also been funding our own teams, because you would be amazed by what our own NHS staff, you know, the ideas they have, what they want to do with just a little bit of money. That competition, the Healthier Futures Action Fund, was like between 5 and 15K. And actually, we had more than 700 applications throughout the country. People are full of ideas. You just need to, you know, help them a bit. Clinical transformation is really important. So, you know, I mentioned those key functions in the NHS, but also the NHS is a lot of care pathways. It's a lot of specialties. And so the same way we look at those vertical functions, we also look at those horizontal clinical pathways and specialty. And so we ask a few questions, right? Like we ask, is the care delivered at the right time in the right place? You know, is it closer to home if it can be closer to home? What are we doing about prevention? Can we keep people healthy rather than treating them in hospital? Once patients need to come to a care setting, how can we make those care settings the lowest carbon possible? And then finally, how do we empower everyone, the leadership, the clinical workforce, the system, to create the conditions of a lower carbon care? So that's a different lens to look at the same things. I mentioned staff and workforce, probably the most important of our program. We know that 9 out of 10 NHS staff are supportive of the NHS taking actions. So all of these are teams that are at the forefront of what they're doing, taking innovative actions, you know, trying to change things from the inside. It's also important that those strategies have a local implementation plan. So as of today, every NHS trust and every NHS integrated care system has a green plan. What it means is that they have a 3 to 5 year plan on how locally they're going to reduce their carbon emissions. And it's important because two systems are not the same, and so they might have different constraints, they might have different priorities, and so it's important that this national program, this national strategy, has a local version. That's a really nice video if you want to see what that looks like in practice. And then just to finish, we're not alone. I know there's a lot to say about COP28, but one positive thing was that yesterday was the first time in history that COP had a health day. So that was a big milestone. And we're partnering with the WHO. We saw the letter earlier on this Alliance for Transformative Action on Climate and Health attached. You know, we speak a lot about the healthcare supply chain, and we know our healthcare supply chains are global, so there's no point going at it alone. And so we're also trying to work with the WHO and other countries to align on, you know, what we expect from suppliers and how we tackle decarbonization. Also sharing our learnings, it's really important. And so we now have more than 70 countries committed to more sustainable healthcare system. So we're not alone anymore, and that's the good news. That's it for me.
Thank you so much. And we're going to have a slight change in the schedule. Are you okay to stay up for some questions? Is that all right? Nadia's just a little bit late. So, does anyone have any questions for the wonderful Sarah? Fantastic.
Thanks, Johnny. Hello, Sarah. Really, really encouraged to see this, particularly also at Giant, because it's such a center of innovation. I'm hoping that you'll really drive the inspiration around the room. I just wanted to ask something about, you know, often the discussion of net zero is how can we have achieved net zero without any loss to lifestyle, right? How much do you think is about finding alternatives, and how much of progress do you think will actually come from fundamentally changing people's energy needs? Because it's all about, you know, at the moment, you know, even it's just about swapping your bank or swapping your supermarket, but there's still, that only kind of gets you so far, and particularly when there's so much kind of green shading happening. So I just wanted to understand a little bit more about the behavioral change aspect, not just the swapping outs.
Yeah, that's a good question, and I'll answer for healthcare specifically. I won't comment on other areas of life. I think there's, for some very specific action, there's a need for money. So when we speak about making our estates more energy efficient, making like decarbonizing our fleet, they will need a bit of investment. But for everything else I've talked about, actually very often it's about doing better, and that's our challenge, is to make people see it. And that's why after the depressing intro, I also tried to show that actually, you know, there's a vision there. Like there's a vision of like a greener system, just like a place where we breathe better, a place where we eat better, we feel better. So there is behavioral change, but actually with lots of co-benefits. And that's what we have to show. And that's why I really love these examples around inhalers, because we know we're not doing well. And so, yes, we can reduce the emissions from inhalers, but we can also just better care for our patients. We can make the life of our asthma patients just really change and be much better. So I was asked last week, you know, is there going to be trade-offs? Maybe, but I feel like we're far from it. I feel like we still have a long list of examples where actually we can make things better. Another example that's sometimes a bit controversial are like virtual appointments. And I know it's like a tricky topic. We're not saying that everyone should go virtual. What we're saying is that we should offer the choice. And, you know, that's what we want, right? Like as patients, we want to have the most convenient way to access the care for us. And so that's what we're saying. We're saying, well, by offering the option of virtual, actually, you offer more flexibility, you offer more choice. So I think for now, there's a lot we can do where actually we can show that it is better. It is not that you have to, you know, forego on something, but it is our task to make that clear and obvious and find ways to communicate that in a way that's appealing.
I think that's a really good point. And I think it's about, if you're trying to sell something to an audience, lots of people downstairs trying to sell things today. And you often have to sell things to your board when you're trying to change the direction of your organization or change the direction of your hospital. And some people want to hear about the financial implications. And pretty much, I'd say the vast majority of the things we've looked at so far are cost saving. Yes, it's going to cost money to get to net zero, but if you lead with a huge energy reduction strategy, and if you frame it in terms of a cost improvement project, I remember, I think Neil Sachdev is one of the board of governors for Nuffield Health where I work, and he said to me, I was trying to sort of get something across the executive body, and he said, well, you're phrasing it all wrong. Just go into your CFO's office and say, do you want £5 million? Yes, I do. Okay, then we'd like to do this. Oh, by the way, it's also going to half our reductions in theatres. So you talk of it in terms of that, but that's not, money isn't necessarily going to be what's on the mind of people working at the coalface. You can maybe make the environment they work in much better, or getting people connected with nature as well. If any of you, you should all look up this guy, Jacob Krasnowski. He's a psychiatrist who's done an awful lot of work on connecting health and nature and the co-benefits, not just for the patients, but for the organizations as well in terms of productivity. So yeah, any other questions? I think this is going to be quite a long Q&A session while we wait for our second speaker, so hope you're ready for it.
Thanks very much for a really great talk. When you showed the pie chart of all the different things that contribute to the carbon footprint, and it can all seem quite overwhelming, and there's so many different things that need to be done. So can you recommend one or two things that we can go back to our trust with this week and say, this is what we need to do now, and we can do it, and get a quick win that we can then show improvement?
I'd say it depends your role, right? So what we try to do with the program is, what we try to do with the program is to pinpoint actions that different staff roles can take. So, for example, if you're a catering manager, I would say, well, actually, is your trust looking at its food waste? Very simple. We know that a massive amount of food is wasted. Food is about 3 to 6% of the NHS carbon footprint. So if we just reduce the waste, saves cost, back to the CFO conversation, and it also saves carbon. If you're a doctor, think about, in the pathways that you're looking after, what can you change? Is it medicines? How can you reduce medicines waste? How can you ensure that there's the right quantity of medicines going to the right patient? If you're an anesthetist or a respiratory physician, I give two very clear examples. If you're a sustainability manager, can you make sure that you secure the investment that's needed to make your building more energy efficient? I guess it really depends, I would say in all of those categories that I showed, there's probably one top action. Travel, active travel, what can you do to encourage staff taking more active travel? And yes, it's overwhelming, but it's also sometimes, it's also a way to engage people. Because if we say, well, the first thing you have to do is to change anesthetic gases, actually that's very impactful, but it's only about a very small team in the trust. So this thing about engagement and how to make sure that you have an action for everyone is quite important. But yeah, that's a few ideas. I don't know if you want to tell me more about what your role is, and then I can give more detail.
Any other questions?
Yeah, thanks again. Great talk, and really helpful to be updated. So this is the NetZero Technology Show, I think. So I'm wondering how, in the NHS, we can encourage and help and get entry for some of the technologies that will help us with this, because there's lots of little startups and bigger companies as well offering ways in which we can reduce our emissions around recycling, for example, and lots of other things too, people who measure supply chains for their carbon emissions and all that. So I know we know how difficult it is for companies to get into the NHS. Is there anything Greener NHS can do to work out which companies are worth getting into the NHS to help us with this?
Yeah, that's a really good question, and one that I get asked pretty often. So first of all, I think these competitions are important. Those innovation competitions we run, It does give sort of a first step. It goes and you know there's a quite strict process to get into the winners and be selected, and so that's a first step. It gives you like a bit of funding to expand, have a strategy to scale up, have a strategy to enter the market. What's your business model? You know, very often we have a really good idea, but then it's a bit like, well, how do you make a business out of it? So that's quite important. The other thing, whenever I'm approached by a startup, the thing I said is, do you have pilot sites? And did you do like your life cycle analysis? So, and I think the life cycle analysis should not be just about carbon. It should be about patient outcome. If you can link your innovation to better patient outcomes or better patient experience or better staff experience, actually it's a win-win. And then if you can show that actually it can save cost, that's even better. So what we've seen work best is like when there's one or two hospitals that have already trialed it, that have done the proof of concept, and then it can spread pretty easily. Because, you know, the way innovations are adapted, you need to do like a business case and you need to show your CFO that it's going to be a sound investment. You need to show your sustainability manager that, yeah, it's worth prioritizing this over something else. So I would say that these are the first steps. There are also like health and research networks all across the country. Worth getting in touch with these because they can also help like creating the right connections, introducing you to like the right teams. Really like making contact is probably like an important thing. So my advice.
One more question. One for
Hi, Sarah. My name's Dr. Costas Fantis. I actually created a startup called Encode Health. Everything that this gentleman has just said, I have to agree with. I've approached multiple hospitals to offer free inventory management and told them that we can monitor their expiry dates. Not a single one has actually taken up my offer. We've won various innovation awards. We've won a SMART grant. I've gone over to America and won awards over them. But what I'm doing now is going to the hospitals that I offered the free inventory management and talking to some of the staff members and noticing when they have to send back their consignment because of expiry. So there was this one hospital that I approached, and in October they had 3 of those big trolleys of consignment that were labeled expiry consignment products. And I sent them a relatively nice email saying they could have taken up our offer in April of this year and prevented hundreds of thousands worth of expiry products going to waste. Is there any way that you can help me give free inventory management to hospitals and not for these executives to just pat me on the head and say, oh, it's a nice idea?
I think I'd be interested to understand, you know, like maybe one thing I might suspect in this case is, you know, just the basic of change management. You have to put in that little bit of extra effort at the beginning to get a new solution, to understand, you know, what is the benefit going to be for me, and so the question is like, how do you make that first? It's not always about the money. It's about, you know, we have teams that are overworked, that, you know, so many vacancies. So the question is, how do you make it feel like actually there isn't going to be that like extra effort at the beginning? There are, you know, there are some like internal forums in the NHS. So as soon as, you know, you find 1 or 2 people who really believe in these solutions, then the word can spread pretty easily. You know, again, like great for those innovation awards. Please do apply to our innovation competition because then we can also help a bit with comms and like supporting all of this. But it's really how do you make it look like it's not going to create more work for you? Like, and how do you find the right person to actually believe in your product and bring it in? Yeah, sometimes it's about that, and it's about, you know, days like today to connect and meet and but yeah, I appreciate it's not always easy.
Sarah, thank you so much for your time. I think we'll all agree we've all learned an awful lot from this incredible human being that's working with an incredible organisation. So everyone, a round of applause. Thank you.